Perfect. So today we have Dr. Firth with us. He has been with Applegate for the past 6 years, and he is board certified in family medicine, as well as hospice and palliative care. Today, the purpose of this video is to educate the viewers about hospice care and its benefits. So, Dr. Firth, what is hospice care?
Thanks for letting me talk about hospice, which is something I love. So hospice care is meant for people who have a life-ending diagnosis, who have estimated 6 months left of life.
Perfect. Who is eligible for hospice care?
Really, anybody's eligible for hospice care if they have a diagnosis that is life-limiting. We have children on hospice care, we have adults, everybody in between, really, anybody.
And what are some services provided by hospice care?
So maybe I could start with talking about what hospice isn't, maybe, and what people are afraid of with hospice. When they hear the word hospice, I think people think that they're going to be on a service that helps them to die. And really what hospice is help people live with the time that they have remaining in their life. So hospice care is really focused on keeping people comfortable, both mentally as well as physically. So there's a lot of emotional stress, as you can imagine, when somebody has a diagnosis of something that's life-limiting. And so we help people not only with their physical ailment through services that I provide, as a physician and nurses provide, also the emotional distress that's provided, help is provided through chaplaincy, social workers, aides, music therapy, massage therapy, different modalities, whatever the patient and their families need.
How does hospice care focus on improving the quality of life?
I think going back to what I just said, it's really to keep people comfortable, provide dignity at the end of life, and help them to enjoy the time that they have left.
What are the roles of the hospice team?
Great question. So hospice is a multidisciplinary team. And part of our role is to communicate really well, both with the patient and their families, as well as with other team members. Probably the key thing we do is communicate. Hospice is there to support a patient and their family. We don't set the agenda necessarily. We're there to hear what the patient and the families want with their time left and help to achieve that as much as is physically possible.
Perfect, I love that. What is advanced care planning and why is it so important?
That comes in several different names. Some people call it end-of-life planning. The legal terms we use are physician end-of-life support plan. Some people call it living will. But that's where each of us individually, I think humans in general try not to think about death. We put it off for a long, long time, right? Even the thought of it. But it's to stop and realize that we're all humans and our lives will end at some point. And we get to designate through that plan, what do we want? How aggressive do we want medical care to be? What does it look like if we can't take care of ourselves any longer? Who do we want to make decisions for us? And how much involvement do we want in those decision-making processes? So it's really important for people to think about it. And I don't think you're ever too young to think about that topic.
What are some of the benefits of hospice care?
So the obvious is we keep people comfortable, right? The dying process is fraught with changes, lack of independence and pain and anxiety and sometimes depression. Sometimes there's issues in the family setting that's bringing someone emotional pain. And so hospice's job is to try to alleviate as much as is possible all of those things. One thing that people don't realize, or maybe they do and we don't talk about it enough, is that the patient's not the only one suffering. All of their loved ones are suffering through this process, right? Anticipating the loss of that person. And so a lot of what we do is to help families in the context of that patient's illness to come to peace. Also to decrease guilt. Sometimes there's a lot of guilt in caregiving, right? Did I do enough? Did I make the right decisions? And we try to step people through that so that when their loved one is gone, there's not any more guilt or grief than they should have to deal with. So hospice also deals a lot after the fact, after someone's passed away, with helping the families, right? We come in and continue to meet with them and help them go through the grieving process, which is a process. It takes time.
Perfect. Thank you so much, Dr. Firth, for meeting with us today, and thank you for your time.
Yeah, my pleasure. Thanks for the questions.